Are you wondering what the best exercises are to do with knee pain? Or maybe you have knee pain with some stuff you're doing, you're wondering if that's increasing it or decreasing it, then you're in the right place. Because today we're going to talk about the best exercises to do to start decreasing your knee pain and increasing the strength in your knee and hips so that you have more stability in your knee. So at the end of this video, we're actually going to walk through the beginning exercises and I'm going to demonstrate those for you. So stay tuned if you're looking for really specific exercises. But first I want to talk about some general things. First thing is cardio. So a lot of my knee pain patients, they like to do walking or running or hiking, and that's very aggravating for their knee pain, right? Because you have that compression going through your foot up to your knee, and it causes a lot of problems. So if you're suffering with knee pain, these are not the exercises I recommend at this time. Now, of course, I love walking and running and hiking in general, but if your knee is really bothering you, they're not the best things to be doing right now. For you, what I want you to be doing is either biking or swimming. And with swimming, you can either do like a water aerobics or you can do a straight up lap swimming. Either way, it's fine. You could even do some walking or running in the pool. I've had patients do that before who just couldn't give up the walking and the running, and so they decided to just go ahead and do that in the pool. But when you're in the pool, you don't have that compression through the knees, and so it's way easier on your knees. Now, in general, I do prefer more of the biking because you get that passive range of motion of the knee through more of the joint range of motion. So your joint range of motion, how much your joint moves might be limited if you have knee pain. But in general, when you're on the bike, you get more motion than you do when you're swimming, even if you're walking or running in the pool. So in general, I prefer biking. However, it may be that if you try biking, that still goes into the range of motion where you have pain. If biking causes pain, then you should not be doing it. So I had a patient recently who has been struggling with some knee pain issues, and I've seen him before for other issues where he really had to just kind of work through the pain, and that is true sometimes. Sometimes there's just things that you have to work through, and I understand that, like muscle pain or fatigue or soreness. Knee pain is not one of those things that you have to work through, okay? When it becomes painful, I want you to stop what you're doing. Now, if you're on the bike, let's say you're out on a bike ride and you've been out for 15 minutes and all of a sudden your knee gets a little bit painful just on one rotation, but then you do the next rotation and it's fine, that's okay. That happens sometimes. I'm not concerned about that. But if you're 15 minutes out on your bike ride and your knee starts bothering you and it keeps bothering you for the next couple of rotations, I'm gonna need you to turn that bike around and go back home, because we don't want to be aggravating the knee. When a knee is injured and it is painful, it's telling you that is a signal that you actually want to stop. Now, you may have heard some other pain research. There's a lot going on in the pain research world right now, and sometimes our brain does get some abnormal signals. However, I am going to tell you with knee pain, it is a very clear signal. Pain means you need to stop. You can try 1 or 2 more reps to see if the pain goes away, because sometimes weird things happen. But if you have pain, then you need to stop, because what's going to happen is it's going to get warm and swollen and even more painful. And when it gets swollen, it gets unstable, and that's not the route we want to go down. All right, so with your knee pain, I need you to listen to it. So even if you're swimming or biking or doing something that is supposed to be good for your knee, it may not be the best thing for your knee. So I need you to listen to your body and make sure you're doing what your knee is telling you is safest for you. In general, you'll find that biking and swimming, being in the pool, are going to be less shock on the knee, which will help to get you more of that cardio exercise without the pain. Another thing I need you to do is to avoid really, really deep squats. So I have had multiple patients who want to work on strengthening their knee because they feel like it's unstable, maybe it's slightly painful, maybe they previously had inflammation and some swelling in there, so they want to work on squats to strengthen their quads. And in general, that's a great idea. Strengthening your quads to protect your knees, thumbs up. That's a really good idea. in general. But I need you to avoid those deep squats when you are having knee pain or when you're even recovering from knee pain. Start with more of a shallow squat initially and work into those deeper squats as your knee decreases in pain and you see your improvement. Also, I don't want you to be trying to be in a deep squat to stretch your knee. All right, if you want to do a quad stretch, I prefer the standing quad stretch where you're standing and you bring that knee behind you. We'll do a video of actually the knee exercises that I do, or knee stretches that I recommend. We're talking about the exercises today, but we'll do another one with stretches to show you that stretch. So check that out. But I don't want you to be trying to stretch it with your knees on the ground or in a deep squatting position. This doesn't allow you to relax properly. You get a little bit too much gravity, and sometimes a little bit too much gravity is actually not a good thing, especially when it comes to those knees. So avoid those deep squats. And the last thing before we get to the exercises, I want you to avoid any exercise where you're putting weight on your knees. So when I was doing some research for this video, I know the exercises that I recommend for people, but I wanted to see kind of what was out there on the, the interweb. And what I found was a lot of exercises where you're on your hands and knees. Please, friends, do not be putting weight on your knees, pressure on your knees when you have knee pain. That makes literally no sense. It's going to be too much pressure. It's going to increase that swelling, increase that inflammation, increase that irritation, increase that pain, and keep you from healing. So all the exercises I'm going to show you today are exercises that you can do without putting any weight directly through your knee. I need you to avoid those initially. We will do exercises to strengthen the knee and hips, but we don't want to be putting weight through the knee because that's really going to cause some irritation and potentially get it more inflamed. So avoid exercises where you're weight bearing through your knees. All right, you ready to find out the exercises that you can and should be doing for your knee pain? All right, here we go. Our first exercise is called a short arc quad. Now, when you're doing this exercise, I want you to be sitting in a chair that has a back. It doesn't have to have arms, but it should have a back, because what can happen is as you're doing this exercise, it can put a lot of pressure through your low back. And we are not trying to cause low back pain while we're trying to fix our knee pain. So make sure you have a good back support while you're doing this exercise. You want to be sitting somewhere where your feet are flat on the ground. And what you're going to do is you're just going to take your foot and you're going to pick it up until it's straight out in front of you and bring it back down. That's as simple as it gets there, friends. You could even do this at the dining room table. You could do this while you're sitting at your desk for work. You're going to do 20 repetitions on each side for 2 sets. So that's the goal, is 2 sets of 20 reps. Now, you may be saying to yourself, well, Dr. Amy, when I bring my foot up above here, I get pain in my knee. Well, friends, then what you're going to do is you're just going to lift your foot up as far as you can before you have pain. And then you're going to bring it back down. As you do this motion more and more, you'll be able to lift it higher. But of course, as we mentioned previously, we want to avoid pain. So you stay in the pain-free motion. Preferably you can go from foot flat on the floor to foot straight out. But if you can't, because it's painful, only go as far as you can pain-free. The next exercise we're going to do is called the clamshell. So for this one, you're going to be laying on the ground. You're going to bend your knees up, and you're going to stack your hips on top of each other. It's really important that these hips stay stacked on top of each other during this exercise. So I like to have people put their hand right there just so they're really aware of where their hips are. You're going to keep your feet together, but you're going to lift your top leg up as far as you can, keeping your hips stacked, and back down. Looks just like a clamshell, right? Now you know where it got its name from. Now, you want to be really, really careful that you're keeping those hips stacked, so you only go as far as you can. If I try to lift my leg up further than this, watch this hip, it rolls back. That's not what we want. And you'll feel it because it starts working all kinds of other muscles. So that's the wrong way to do it. Keep those hips stacked, go as far as you can without any pain other than fatigue, right? You should feel those hips start burning pretty quick. So make sure you keep your hips stacked and you don't do that rolling back. You're going to work up to 2 sets of 20, but of course if you get fatigued before then and you start losing your form, then stop the exercise. Just do as many as you can before that fatigue sets in. The next exercise we're going to do is bridging. But when I do bridging, I like to do it really, really specifically, because what we're trying to do with this is really get activation of the glutes with this and not so much the hamstrings. Now, yes, the hamstrings are going to work. Some people say you can do a bridge without using your hamstrings. I don't know how to do that, and I don't know I don't even know what those people are talking about, okay? But you want to activate your glutes, focusing on the glutes and not relying on the hamstrings. So for this one, you're laying on your back. Your feet are underneath your knees. You're going to squeeze your glutes to push you up. And what you're trying to do is get up to knees, hips, shoulders in one straight line. Activating those glutes and then slowly lowering back down. Now, like I said, when you do that, you will feel the hamstrings activating as well, but the goal is that glute is driving those hips up and then letting you rest back down. You just don't want to have too much strain through the hamstring with that one. The goal with that is to do 2 sets of 20, but remember, you just go to fatigue to start with. You don't want to be doing anything with incorrect form. So make sure you know what you're doing and that you're not getting too tired. Keep that form up through all the reps that you're able to do, working up to 2 sets of 20. All right, we're ready to get our Jane Fonda on here. We're going to do some hip abduction. I know, it's a weird word, but what it means is we're going to start laying on our side. Now, I like to have my bottom knee bent because it helps to give me a little bit more stability. You could have it bent or straight. Either way, you can do the exercise correctly. Just want to make sure that you feel really, really stable while you're doing this. Just like in the clamshells, we're going to put our hips on top of each other and keep them stacked. So we're going to put our hand there so we can make sure we're keeping those hips stacked during the whole exercise. You're going to lift your leg up, but you're going to lead with your heel when you're coming up and down. The reason why we lead with our heel is we want to make sure we get those muscles in the back working. If we lead with our toe, sometimes people will feel it more in that front, and it causes that hip to roll backwards. So think about leading with your heel, and you'll really feel it at that posterior line of your leg. Our goal with this is 2 sets of 20, but remember, we only go to fatigue to start with. So do as many as you can with good form until you hit fatigue, working up to 2 sets of 20. All right, our last exercise for this group, we're going to do a straight leg raise. We're going to start laying on our back. Now this one you can actually do on the floor, you can do this one on your bed, wherever you feel the most comfortable. You're going to try to straighten your leg completely, which involves pushing your knee down and your heel out, and then you're going to lift it up. Now it's really the beginning of this exercise that's the important part for your knee, so you can decide how far you feel comfortable going. So one leg's going to be straight out. Now I like to leave my other knee bent because that helps to keep my low back really protected and make sure it doesn't get irritated. It can be straight out, whichever feels most comfortable for you. Just make sure that that low back and pelvis is really, really stable. So you're going to start by pushing your knee really straight. Heel is going towards the wall over there, and then you're going to lift it all the way up and down. Now remember, knee down, heel out. It's the beginning part right there that's really getting that strengthening. I like to go up a little bit higher because I get a nice hamstring stretch too, and why not bonus on this one, right? You get a twofer. But you don't have to. Knee down, heel out, you're going to go up, that's about 45 degrees or so, and come back down. That's really all you need to do, unless you want to add in that hamstring stretch and go for the twofer. What is your favorite knee exercise? Leave a comment below and let us know if you tried these exercises and how they worked for you, or if you have any other exercises that have been really helpful for your knee pain. Have a great day, everyone.